Yeah, man, good evening. Delvin Sadler again. And today is actually, today what again? today, yeah, right, today is Thursday. Yeah, today is Thursday. Yeah, man, today is Thursday, so tomorrow is Friday, and then it's your long weekend. Yeah, man, man, what you call it? What the color you again? Yellow. Please brighten up. Just like in Jamaica, and the place brighten up and think. Yeah, man, sometimes you miss your homeland. Yeah, man, sometimes you miss Jamaica. Delvin was born there, came here when I was 14 years old. Yeah, so I've lived there for a very long time. So, this is home for me, but, we never forget Jamaica. Yeah, I never forget it. Straight up. Yeah, great people down there. The vibes and the culture is great. Yeah, man, so big up to Jamaica. Big up to all the people that are down there. Yeah, man, good evening, Kizzy. Good evening, Genevieve Bowen, Dimple, big up yourself. Big up yourself, Timothy Borland. Yeah, man, it's Delvin Sadler. I'm here. I'm here to actually um, tell you guys that I'm gonna be here every day. Yeah, man, I love doing the show for you guys. Yeah, man, I love spending quality time talking to you guys. Indeed, you guys are wonderful people. You know what I mean? It's contagious to be around good people. Yeah, great people. I love you guys, may I tell you. I love coming here and do the show. And I love the interaction that comes from you. And I like the fact that you actually take the time out of your day and come here to spend it with me, Delvin. Yeah, man. Yeah, man. Big up on yourself, man. Big up yourself, Genevieve. Yeah, man. Um, yeah, man. Let me say thank you from the bottom of my heart. Yeah, man. I love that. I love that you do that. Kim, good evening. Big up yourself. Carleen Mason, thanks for joining Unscripted. Anything goes. Yeah, man. I want to thank you guys for taking the time out of your days to come here and actually listen to me and to actually participate in this show, Unscripted. Anything goes. Clearly, you like what you see and you like the environment that has been created so you can participate and be a part of the show, and I appreciate that very much. Yeah, your continued support is appreciated, for real. Yeah, man, thanks for coming on. I love you guys. I really do, from the bottom of my heart. I really love you guys. Yeah, man. I actually go through some of the shows them, and when I look at the quality of the shows, I'm impressed with it, because when I look at other things that are out there, you know, it's a lot gossipy, a lot talking people business, but you actually come here and actually learn from you guys, and you can learn from me. And what more can you ask for? You know, a learning moment and a little bit of humor, a little bit of everything. Yeah, man, give thanks. Thank you guys for coming. So, you know, the format of this show, Unscripted Anything Goes. There's no format. It's actually unscripted. Yeah, so we have a topic that we discuss, but you can actually change the topic at any time you want. Yeah, man, you can change the topic at any time you want. You can actually come on camera at any time you want. Yeah, man, just click on my name and I will accept you, and you come on the camera and you can give your input to what we're talking about, or you can even change the topic and talk about something. You can sing a song, you can do whatever you want. This is the format. It's unscripted and anything goes. Yeah, man, straight up. Yeah, man, for real, for real, for real. If you don't want to come on the camera, you can just type, and Delvin will respond to what you type. Yeah, or just read what you type. Yes. So, with that said, we have a nice topic tonight. And this is going to be a 2-part series on this topic, oral sex. We're going to talk about the health benefits tonight of oral sex. And then tomorrow, we're going to talk about the unhealthy benefit of oral sex, unhealthy aspect of oral sex. Yeah, the possibilities of certain things that you can get when someone is actually infected or exposed. Yeah, so I'm going to tell you some of those things that you can actually catch while doing oral sex if your partner actually has some of those diseases. So from that point of view, out of fairness, we balance it. So, but tonight we're going to talk about the healthy aspect. Tomorrow, the unhealthy aspect of it. So, yeah. But in general, yeah, the act itself, the oral sex, is a good thing. Yeah, man. I partake in it. It's a good thing. So, yeah, it's a good thing. Yeah. So tonight is the healthy aspect of it on our show called Unscripted. Anything goes. The show called Unscripted. Anything goes. The show called Unscripted. Anything goes. Unscripted. Anything goes. For real. Big up yourself, Carlene. Big up yourself, Delia. Yeah. Big up yourself, Giovanna. So, yeah, man, straight up. So, we're gonna go straight into the show. And that is the healthy benefits of oral sex. And this is a 2-part series that we're having. Today, we're talking about the healthy aspect of it. And tomorrow, we're going to talk about the risk that you can actually get by doing oral sex on a person that is actually contagious with infections or disease. So we're going to talk about that tomorrow. But as for today, let's start. So first, let's describe to the people what is oral sex. A lot of you may know about it, or not. A lot of you are not familiar with the actual terminology, but you know about it. In Jamaica, you might say, them bow. Them bow, them bow, them bow. Girl on the table, you know that them bow. Blah, 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 blah. You know, so that, yeah, you bow. So, back in the 80s, that was a top song down in Jamaica. Yeah, so they used to call people bow cat. Yeah, that means the man them who hit vagina, bow cat. The ladies who actually do oral sex on the man, they call the ladies bow cat. They call you pussy sucker, cock sucker. Yeah, those are some of the terminology that they use. But the proper terminology is called oral sex. When the man actually does the oral sex on the woman, it's called cunnilingus. And when the woman does oral sex on the man, it's called fellatio. So oral sex is the actual sexual activity with your partner with the lips, the mouth, and the tongue. Yeah, this includes sucking, licking of the penis, the vagina, the anal, the vulva of the clitoris itself, or the vagina itself. So that is oral sex. Yeah, that is oral sex. And this can be done by the man or the woman. It's called fellatio when done by the female, and it's called cunnilingus when actually done by the man. Yeah, well, we have to give you the proper terminology, proper definition. So, you know, it's a professional thing. It look good. It sound good. Yeah. But if you're Jamaican, you call them bow cat. Yeah, I remember I was in Jamaica the other day. Yeah, just a little bowcat story. I was in Jamaica the other day, and I actually went up to the country. And my wife and I went up to the country, and we're having a discussion pertaining to sex, and with my cousins. And yeah, so one of my cousins, so they asked me if I do that oral sex thing, if I eat vagina, and I said yes, I do. Yeah. So now all of a sudden, um, when one of my cousins now is now introducing me to another cousin, he's saying, Delvin, he is a bowcat. I'm a bowcat. Yeah, I'm a bowcat. Yeah, so my wife stepped in and says, but what's wrong with that? You know what I mean? So she stepped in and started to take the man out. So then I had to interject, and I said to them, I'm proud of you saying that about me. The fact is, I go above and beyond to please my wife, and my wife go above and beyond to please me. That is what is needed for a healthy relationship. However, if your wife or your girlfriend wants to be pleasured that way, and you chooses not to do it, that is your prerogative, and that is fine. However, that is an unsatisfied person that you now have in your relationship. Those desires and those needs are there for you to fulfill for her, or she fulfills for you. However, if that person now feels unsatisfied, now the doors are now open for infidelity or cheating. That is now a bigger risk that one takes. Yes. So as for me and my household, it doesn't matter what. It is my job to make sure that my wife's sexual needs are taken care of, and her job is to make sure that my sexual needs are taken care of. It's called relating, and I will always relate to her, and she relates to me. If you don't want to do that with your spouse, that is okay. That is between you and your spouse. Yes, the ramification of that, it is also between you and your spouse. Yeah, man, that's what Delvin has to say about that. Big up yourself, Michelle Sands. Big up yourself, Carol Clemens. Yeah, man, big up on yourself. So tonight we're talking about the healthy benefits of oral sex. And then tomorrow we're going to talk about some of the risk that you are taking when you have oral sex with someone who is infected or even has a disease. So just to balance it off, tomorrow we'll deal with that. Yeah, man. Yeah, man. Big up yourself, man. Yeah, man. Big up yourself. Yeah, man. Straight up. Yeah, man. Yeah, man. Yeah, man. Straight up. Thanks for watching, And I was telling the people them earlier that, I appreciate you guys coming here every day and spend some time with Delvin. Yeah, man. And I'm so happy to have you guys here spending the time, because you're actually taking time out of your day to spend with me, and I'm taking time to spend with you. So our companionship is valued by me. Yeah, man, big up on yourself. I love you guys. Yeah, straight up, and will constantly be here for you. Straight up, anything we can talk about here, because we're real people talking about real things that affects real people. Yeah, man, and Delvin is a real man talking to real people. Straight up, and a big up on the chest. Yeah, man, big up on the chest. Delvin to the world, and you to the world. I love you guys. So we just described what oral sex is all about, right? So now we're going to talk about some of the advantages of performing oral sex. Yes, some of the advantages of performing oral sex, the health benefit that comes with doing the act itself. Yes, straight up. And I did not know a lot of these things, so I am being educated by it as well. So as I read and I start to gather notes, I mean, it blows my mind what oral sex actually does. Yeah, the amount of benefits that actually comes from it. For real. I guess if some of the people who are against it actually know the benefits of it, then actually they would actually do it. Do it. Yeah, man. Big up yourself, Anika Beckford. Thanks for joining Unscripted Anything Goes. Yes. Yeah, man. DJ Chrome, big up yourself, my brother. Chrome International. Yeah, my sound that all the time. Yeah, man. Straight up. Yeah, so tonight we're talking about the benefits, the health benefit of oral sex. And then tomorrow we're going to talk about some of the risk that you're taking when you do oral sex to someone that is infected or has a disease. So that is the risk part tomorrow, and today are the health benefits of the oral sex. Straight up, big up on the chest. So first of all right, when a woman when a woman gives oral sex to the man, it is actually and she has like wrinkles and all of these things. Yeah, the oral sex is an anti-aging effect to her. Yeah, big up yourself, Tiffany. Yeah, man, big up yourself. So giving oral sex to the man is actually an anti-aging for her. Yeah, it can reduce wrinkles or stop the increase of her getting wrinkles. Yeah, by giving oral sex to the man. Yeah, and I'm going to tell you how that occurs. Yeah, man, big up yourself, Tiffany. Tonight we're talking about some of the health benefits of oral sex. And then tomorrow we'll talk about the risk side of it. Yeah. Yeah, man. So when she gives oral sex to the man, yeah, it's now an anti-aging thing. So let's say she uses anti-aging cream. Yeah, she uses anti-aging cream to reduce the effects of wrinkles. She don't need to now use that. She need to just have oral sex. Yeah, she need to actually give the man blowjobs as often as possible. Not only that, when she gives the blowjob, the semen, she should swallow it. Yeah, the semen has a whole heap of things in it, you know. Yeah, the semen has a whole lot of things in it. When she gives the blowjob, she must actually swallow the semen, because that is actually the best part. Yeah, aside from the man having the pleasure of the oral aspect of it, to her, yeah, the semen is actually can be used as an anti-aging device. Yeah. Yes, for real. Yeah, man. Yeah, it's an anti-aging serum. Yeah, you're right. Yeah, sperm is an anti-aging serum. Yeah, for real. Yeah, you know that, Tiffany. You know your thing. Yeah, it is. Yeah, so she don't need to use the cream. It's good for the skin, very much so. So she all she has to do is to swallow the semen. Yeah, the semen. Yeah. And she will notice a lot of differences in her skin. Yeah, the tone of it. Yeah, she might find that it's going away. It's not getting worse. Yeah, believe it or not, get rid of the cream, and actually the sperm is actually better than the creams that they have in the store. The sperm. Yeah. So she must swallow the semen though. Yeah, don't put it on the face and rub it up. No, swallow it. Yeah, swallow it. Yeah, but so it actually goes into the bloodstream. The sperm contains a chemical called yeah, man, big up yourself, my brother. The sperm contain a chemical called spermidine. Yeah. Yeah. Yeah, man, diet has a lot to do with the taste of the semen as well. Okay. Yeah, I wouldn't know that still, but thanks for letting me know. Yeah, man, hope she don't get pregnant from swallowing. No, she don't get pregnant because it's not going up into the uterus. It's going into the stomach. Yeah. Yeah, man. No, it's serious. Yeah, Carol, this is not a joke thing, eh? This is not a joke thing. This is real. This is real. Yeah, the sperm contain a chemical called spermidine. Yeah. And that can helps the skin cells to get slow to get slower, get wrinkles at a slower rate, and actually reduce the effect of wrinkle. So when she swallows the sperm now, it is actually a better. The sperm has more spermidine in it than what is in the anti-aging wrinkle cream. So it's actually a natural and more potent effect on the woman skin tone than actually the anti-wrinkle cream. Yeah, man. Actually, rub it on the skin and allowing it to dry like a mask is also good as well. Okay. Yeah, from what I read, it says you must swallow it. Yeah, man, make up yourself, Kevin Tabby. Yeah, man, yeah, man. Yeah, I didn't know all of these things, until I read it. Yeah, and it's just by buck up why we end up in this topic because of last night's show. So I'm talking about the health benefits of oral sex, and tomorrow we're going to talk about actually the risks that are involved with actually doing oral sex on somebody that is infected or has diseases. There's two different things. But if you're healthy and you do oral sex, it is quite healthy. Have oral sex. Enough of it too. Yeah, I know you can see there's a lot of benefit in it. Swallow sperm. So when you see the sperm there, yeah, don't just make it go to waste, woman. Swallow it, please. Yeah. Yeah, man. Yeah, man, DJ. Yeah, man. Yeah. Yeah, man, for real. Yeah. This is no joke. Yeah, man, big up yourself, DJ. Yeah. Yeah, man, swallow the sperms, man, because it has spermidine in it that will actually reduce the appearance of wrinkles or slow it down or give you less wrinkles. So the more sperm you swallow, it is actually better for you. So, woman, swallow away. Swallow away. Yeah, swallow away. Yeah. If you were afraid to swallow, no, don't be afraid. Swallow away. Yeah, what about the men? Yeah, so I'm going to touch about the men later, but we're going to deal with the women them first. Yeah, we're going to touch about the men them after. Yeah. Well, you're going to wrinkle? Come on. You don't want to look like an old wrinkled granny. No, you don't want to do that. You see, that's why a lot of the older women them back in the days, because they weren't exposed to a lot of oral sex and swallowing that because they thought it was a bad thing. A lot of them had a lot of wrinkles. But look at the women them as they're aging now. They're aging gracefully because they find out these secrets now and they're swallowing sperm on a regular basis. So they're aging gracefully. So you don't really see grannies around like that anymore. Yeah, unless they are older generation, but the newer women, they're aging nice and gracefully. Yeah, I like it. Yeah, man, I like it. And Delvin like the older women them too. So, I see those things on a regular basis and I notice. So now this give me the explanation of what's going on. They're actually swallowing sperm. Yeah, man. So you need to start, DJ. You need to start swallow more sperm. Yeah. Yeah, man, do a lot more oral sex, Yeah, man, do a lot more oral sex. It's very, very good. So, yeah, man. Yeah, man. So it actually prevents man from developing prostate cancer. Yeah. Actually, yeah. It prevents man from developing prostate cancer, ladies. The more you do oral sex on him. Yeah, man. So blow him as often as possible. And I'm going to tell you why. All right, let's see what Carol Clements has to say now. All right, very informative. Never heard this before. I don't want to do oral. For those who do, good luck. I'm very old-fashioned too for that. Good info for you, the young or mother. Yeah, so it's not for everybody. Like, you know what I mean? Yeah, if you're one of those old-fashioned person, yeah, the only problem is that if your man want it. That is the only problem. If your man want it, what is he going to do? Yeah, man. No, it's not a lie. It's true, man. It's true. Yeah. So it's a good. It has spermidine in it that is very good to reduce the effect of wrinkles. So Ava, yeah man, do it man, it's good. And as for the actual what do you call it now? The man now, yeah, when the woman performs oral sex on him, yeah, the more frequent she does it, it reduces chances of getting prostate cancer. And I'm going to tell you why. Yeah, it says when the woman gives the man oral sex, the more he ejaculates in life is the less risk he has to develop prostate cancer. Yeah, the more he ejaculates. So you can have sex, right? Or you can do oral sex, whatever it is. But the more time that he ejaculates, it's the less chance he has to develop prostate cancer. Yeah, man. The more time he ejaculates, the ejaculation aspect of it keep the prostate active, and don't make it reduce the chances of it developing cancer. So that's what it says here. You're just reading what it says. So you go ahead and blow more, and actually give him more sex so he can ejaculate more. Yeah, man. Or masturbate straight up. Yeah, man. For real. That's what it says here. Yeah, man. Yeah, man. So you tell your man, ladies. Yeah, man. Lay down and let me blow you. Yeah. Yeah, man. Yeah, man. Yeah. No, it's not a man who wrote this. It's a woman who wrote this. Sorry about that. Man, big up yourself. Yeah, man, but this is a lot of news to me, you know. Big up yourself, Debbie. Big up yourself. I love you, girl. Mwah. I love you. D-Mac, big up yourself. I love you, girl. Mwah. Thanks for joining Unscripted Anything Goes. So we're talking today about the health benefit of oral sex. And tomorrow we're going to talk about the risk that you can expose yourself to if you have oral sex with somebody that is actually infected or has disease. So the risk portion is coming tomorrow. But today we're talking about the health benefit. I'll lie you tell a man that no, it's a woman. It's a woman wrote this. A woman wrote this. Yeah, man, you can go online and research, you know. You don't have to just take my word for it, girl. A whole heap of different writings on this. Not just one. So you don't have to take my word for it. Just go and research. Just type it in. Health benefit of oral sex. That's all you need to type. You see them come up. Yeah. No, yeah, everything that I tell you is online. Everything can be researched. Yeah. No. I don't make $1 from this, so I don't need to tell you any lies. I don't make not even $1. Yeah. No, I just like, to actually teach, present lectures and to actually talk to people. And this is our forum, so we just work together. Yeah, man, I read several different sources. Yeah, but that's why I said, Debbie, you have to listen to what I say. You have to listen to what I said. Tomorrow, we're going to talk about the risk aspect of it. Today, health benefit. There's too much. There's too much to actually present in one night. So tonight, the health benefit. Tomorrow, we're going to talk about the risk. You okay with that, Debbie? Debbie? You okay with that? It's too much. You're supposed to confirm tonight. Yeah, then you never listened last night. I told you last night that I was going to come and deal with it from the health side and also the risk side. But there's too much to do in one night. So I split it to a 2-part series. Yeah. Tonight, health. Tomorrow, risk. What is no? What is no, Debbie? What is no? Yeah, I have 4 pages here of information to go through tonight. What is no? What are you talking about? What are you talking about? Yeah, this is all health benefits. Tomorrow is risk. There's a lot of risk out there. Tons of risk. Everything is risky. Tons of risk. Yeah, all of the syphilis, whatever, all those things you're talking about. Yeah. If a person is not healthy and you perform oral sex on them, you open yourself to risk. So tomorrow I'm going to lay out all of those tomorrow night. A whole heap of them, HIV, everything. Tell the people them that throat cancer is linked to throat cancer. Why you switch it on? More risk than benefit. No, man. Actually, I guess everything is a risk when somebody is infected. Yeah. Everything is a risk when somebody is infected. If somebody is infected with something or has a disease, that's a risk. With your husband at your yard, you know if your husband I mean, I would hope that you guys go and get your annual physical done, so you know if you're clean with your husband or your wife at home. I would hope you do that. Yeah, but you should be practicing these things with your husband and your wife at home if that's what pleases you guys. In my opinion, semen is produce children not to drink. I may be wrong, but that's yeah. Well, I'm telling you the health benefits. You don't have to practice it. I'm just telling you what the benefits are. Yeah, none of you don't have to practice it. Yeah, this is not a bully pulpit where I'm now gonna control your bedroom. Delvin can't do that. No, I'm telling you, yeah, what the health benefits are. And then tomorrow I'm gonna tell you what the risks are. No? You don't want to do that? Debbie, you don't want to do that? If you don't want to do that, then we can change the show. Yeah, and then you can take over and talk about health, the risk. Yeah. But me normally organize myself thoroughly when I come here. So if you're organized to do that, then I can allow you to do that. But if you're not, then you're going to have to do it my way tonight. Yeah, we're doing it, the risk, the health, and then the risk tomorrow. Yeah. So if you want to switch it around and you're organized to do it, the risk tonight, then go ahead. You come on and then I allow you the forum to do that. And then I'll present the health tomorrow. But my way is to do the health first, and then tomorrow I do the risk. Does it whiten the teeth? It says here that if you want to talk about the teeth, yeah, it says, let me turn around the paper here, because I did put something here about teeth. Yeah, it says it's good for the teeth. Good for the teeth. It's a bleaching agent. It's a bleaching agent. Okay, so you're going to work with the format tonight? Guys, it's unscripted and anything goes. It's not a bully pulpit. Yeah, but everybody was okay so far. Until you came in. Yeah, man, everybody was okay until you came in. And I explained to the people them exactly what I told you. And then I explained to you what I am telling you. And you seem to actually, you're not too amused by it. There's a lot of information online. Tons of it. Whole heap of it to go through. I was sitting there for 2 hours reading constantly. And actually making notes. Yeah. Tons of information. I don't want to give you a half-hearted show where I'm presenting you with not facts or I'm presenting you with half the information. No, that's why we're going to do a 2-part series. One on the health benefit and one on the risk. I think that's fair. Yeah, very good information and listening carefully. Good show. Continue. I want to hear it all. Yeah. So you don't want to actually give a half-hearted situation. You just run and just say, okay, this is the risk. No. I'm a balanced guy. Yeah, man. I just came out. You said last night you would have come with the risk. No. You're wrong. Yes, I say you have to listen to what I say. You only hear what you want to hear. I had said I am going to bring the health benefit, and I'm also going to look at the risk. That is exactly what I said. Go back and listen to the show. Yeah, you never listen. You don't listen what you want to hear. You got to open up your ears and listen. Yeah. Yeah, and then I actually said, like, I have photographic memory, just so you know. And then I actually said, then I'm sure on it it's going to say, it's not going to say you shouldn't do oral sex. Yeah. Go ahead and go back and listen. That is what I said. Yeah, I memory lock information. Yeah, continue. Why should one person make decision for the room? Okay, no, we're good, man. People listen up. Yeah. So we're actually going to do the health benefit tonight. Then tomorrow we're gonna do the risk. Yeah. No, she's not. No, man. You know, so Debbie, I'm a girl, man. Yeah, we have to listen to Debbie. You know, you have to listen to Debbie, cause this is unscripted, so we listen to everybody. So if she's not in agreement, then we have to hear why she's not in agreement. If she thinks she hears something different, then we have to say that. We have to clarify. Yeah, because I don't like to move on without proper clarity. Yeah, straight up. Yeah, straight up. Yeah, man, straight. Yeah. So, yeah. You just confused me then. What did it? Yeah, where was I? Yeah. All right. For pregnant women now. Yeah, pregnant woman. You know this one, all of you guys, because a lot of you guys were pregnant before. You know, like when a woman is pregnant, yeah, too much vaginal sex can actually cause damage to the baby and to the woman. Yeah, but if you do it the normal way, it can cause damage. Or, you push the baby too much here, you put that there. Ladies only benefit. No, man, no. What I mean is that if your woman is pregnant, yeah, man. No? Ermin, right? No, it don't give damage. The vaginal sex. You can't brutalize your wife like how you brutalize her when she's not pregnant. You can't flip her and turn her and flip her on her stomach and all of these things. No. And sometimes for a lot of women, she's uncomfortable. Yeah, she's uncomfortable. Maybe one position she like and it's from the behind or something like that, on her knees or stuff like that. Yeah. So some women don't want to do it because they actually feel uncomfortable or it could do damage to the baby. Those are the consciousness of the woman. So in order to reduce these risks, it says here, yeah, the woman, yeah, satisfies her man, right? And he satisfies her orally, pleasuring her. Yeah, that keeps the closeness and the bond between the man and the woman. Yeah. So let's see what Kevin has to say. Yes, for real. Some ladies make up differently. Yeah, it's not about comfort. Can never harm the baby. Yeah, well, according to what they said here. Yeah, you can't roll a woman on her stomach. You cannot roll a woman on her stomach and have her lay down on her stomach. You cannot actually push her legs in a certain, like you used to prior to the sex. That can actually, yeah, hurt the child. Yeah, man. You cannot have sex with her in the normal way that you used to have sex with her before she was pregnant. Yeah, so for the safety of the baby, yeah, some woman chooses to have less sex or no sex. So the best thing to do to please each other, oral sex. That's a great healthy form of actually pleasing each other. Yeah, man. I always say, yeah, man, big up yourself, Shanti. I love you, girl. Thanks for dropping in. Yeah, it's not about comfort. Okay. Well, never. You know more about that than me, but me just read to you what I read. The best way to maintain closeness with each other and satisfy each other is to perform oral sex, it says, during pregnancy. Yeah. and still maintain a great healthy relationship and satisfaction sexually. Yeah, yeah. So you're pregnant and you're having morning sickness, ladies. You're pregnant and you're having morning sickness. You suffer from extreme nausea. Yeah. The best way to deal with nausea is to do oral sex on the man. Yeah. And swallow the semen. Yeah, the best way to deal with nausea is to do oral sex on the man and swallow the semen. Because the semen contain nutrients that reduces the symptoms of sickness, of nauseous sickness during pregnancy. I never write that. That them said. Yeah. So you must perform oral sex if you have a morning sickness. Yeah. On the man. And swallow the semen. Because the semen the semen reduces the symptom of nausea during pregnancy. Yeah. And reduce the morning sickness. Yeah, man, that's how it said. Yeah, that's an health benefit. Yeah, man. So go ahead, blow away. Blow away. Please do blow away. So not only you're satisfying the man orally, you're actually calming those feelings of nauseousness, that those side effects of pregnancy. Yeah, man. All right. Oral sex also reduces stress. Yeah, stress. Yeah, it reduces stress. Also, pertaining to the woman. Yeah, man. Yeah, man. The more you are actually exposed to semen, you can actually reduce the effect of depression and stress. Yeah. Yeah, swallow the semen, it's it. Yeah, man. The sperm has a chemical such as estrogen. It has cortisols and oxytocin. And from we talk about that last night, those are well known for the effect of it gives you happy feelings. It gives you feeling of positive feelings. So that will reduce your depression and your stress. Yeah, man. Yeah, man. Yeah. No, it's not a medicine book. No, read that. No, it's online. Just go online and type it in. Yeah, just go online and type in what health benefits of oral sex. Just go and type that in. What heap of articles come up? Tons of them. And if I even have time to go through all of them, but I got through a few of them to actually put this together. Yeah. Yeah, just type health benefits of oral sex. Yeah, even while we're talking right now, you can just listen and read at the same time, and you'll see what I'm reading here is what's there. Yeah, man, big up yourself, Sheldon, my brother. Yeah, man, we're talking about the health benefits of oral sex tonight. I didn't write this. I'm just quoting. I'm just quoting. Yeah, I'm just quoting. I'm just quoting. So you have to try this out, ladies, to find out if it works for you. Don't say Delvin said that you should do that. No, that is the wrong thing. No, don't say Delvin said that. Yeah, this is what they're recommending online. That, based upon their scientific studies, that this is what can happen to you if you do oral sex and swallow the sperm. Yeah, man. Yeah, man. Make up yourself. Yeah, man. So it can reduce the stress if you swallow the sperm because it contains a chemical such as estrogen, cortisol, and oxytocin. Yeah, and those are feel good chemicals. Yeah, man. Straight up. And they actually have medicines for those, that contain these chemicals. So, to get that all from the sperm. And it is natural. Yeah, and it is natural. Go ahead, lady, blow away. Blow away. Yeah, man, blow away. Yeah, man, blow away. Yeah. Let me see what Debbie has to say. Sonny Albany, psychologist, the best way to cure morning sickness when you're pregnant is ingesting what's made you sick in the first place. See, man. Yeah. Well, go ahead, read it, though, man. Read it, though, man. Yeah, man. Yeah. Why the sperm will make you sick? The sperm don't make you sick. Yeah, man. Big up yourself, Jeff. Big up yourself, Jeff. Pharmacy better starts bottling semen for sale since it's a good for health, I guess. Yeah. So what they did is, they know that these chemicals are in the semen, so they actually make them and put them in pill format. So you are swallowing those pill format with a whole bunch of other things attached to it. But why do that? Just blow your husband away and swallow the steam and I can get it naturally. Dear God, what about the woman who passed childbearing age? Yeah, man. Good for you too. Yeah, it's good for you. I told you the health benefit. Yeah, man. What about health benefit tonight? It reduces the stress for you. Yeah. It actually it reduces stress for you. It anti-aging cream. Yeah, it's like how you pass childbearing stage now, Ermin. Big up yourself. I love you, girl. It's like how you pass childbearing stage now. Yeah, the more you swallow is you reduce the sign of aging. You won't get as much wrinkle, or it will tone up the wrinkles them. You'll notice a difference instead. That me say that. Yeah, you would actually notice difference. You would age slower, so you don't have to use anti-wrinkle cream. Yeah, just swallow the semen, and it worked. Yeah, man. Yeah, man, and you can. It's good for your teeth, them. Good for your teeth, them. Yeah, so there's benefits for all women. The young one and the old one. So, ladies, blow away. Blow away. Yeah, man, blow away. Yeah, blow away. And not only that, ladies, while you're listening to me, you can actually Google and type these things in. And then you'll see that what I'm telling you is what comes up. Yeah, so don't just take my word for it. Yeah, Google. Yeah, that's why it's there. Big up yourself, Jeff. Yeah, man. So, yeah, semen is good to ingest, ladies. Blow away. Please do on a regular basis. Yeah. Let's go start making milking and drinking now. Yeah, man. Go ahead. Start right away. Don't wait. Start right away. Yeah, man. Would sure love that. And you'll get the health benefit of it. Yeah, man, for real. Yeah, man, blow away, man. Yeah, blow away. Yeah, blow away. Yeah, please do. So, tonight we're talking about the health benefit. Tomorrow we're going to talk about the risk that you can be exposed to when you're having oral sex with somebody that is infected or has diseases, sexual transmitted diseases. So we're going to talk about those risks today with those people. But, for you guys who are in the room who has clean spouse, yeah, if you have clean spouse, or if you don't know if you have a clean spouse, get tested, both of you. Yeah, so let me put out that disclaimer. If you have a clean spouse and you are clean, blow away. Yeah, have oral sex. If one of you are infected or you don't know if you're infected, go and get tested. To make sure that you're clean. Yeah, and if you're clean, then blow away. Yeah, and if you're infected, yeah, man, get the help for the infection or the disease that you're carrying. Yeah. But the right thing to do is to get tested. Please get tested. I beseech you to get tested. Yeah. So you can actually know if you're healthy. Yeah, man. Bless up yourself. Yeah. Yeah. But please, ladies, lots of benefits are there for you health-wise when you give your man oral sex. So blow away. Go ahead and blow. Yeah, man. We love it. And swallow too. Blow away and swallow. Because that swallow part is the most important part for your health. yeah, that's the most important part for your health. So go ahead. Blow away and swallow. Yeah. yeah, man. You have some undercover people who are watch this show here, you know. Some undercover people like artists. You're gonna hear them put these things in song. I bet you they're gonna put these things in song. They're copying us here and Unscripted anything goes. Cause we real. And they're gonna copy our ideas and our, you know. Yeah, man. We women who pass childbearing better get younger, man. Cause the men don't have enough to swallow. Maybe only taste. Alright. But you can exercise your mouth, you know. You exercise your mouth. That's a part of it now, which exercises the muscles in your face, which exercises the skin, which tone your skin. It's always a benefit. Yeah, it's always a benefit. yeah, man, it's always a benefit. And not only that, it's good for breathing too. It's good for breathing because you actually have to know how to breathe to actually do it the right way. Yeah, man. So blow away, please do. Blow away. Yeah, man. Misinformation the woman them. Misinform the woman them. No, we're not misinforming. That's why I said to you. Yeah. Mandy, listen to me, man. You can't come on camera. Mandy, come on camera. Let me see if Mandy will come on camera. Come on camera there. Yeah. You, Mandy, come on camera. May you talk. I love you. So let's talk for a little bit. Come on camera, Mandy. Let's talk. Let's have a little dialogue together. I love you, girl. Come on, let's talk. Answer the thing, man. You don't answer? No? Alright. You don't want that then. Alright. So, Mandy, remember I told you that, you got to have to, don't just come on this show here. This is not a bully pulpit. No, you have to actually do your research. So if I provide you with information, yeah, go and Google what I tell you. Yeah, that is the only thing. But you don't make a claim about misinformation when you have not, checked it out. So just go and check it out. And then you come back and you say, Delvin, it is wrong. Yeah, me can accept that. But me gonna tell you what me read. Yeah, man. Big up yourself, Mega House. Yeah, man. Big up yourself, my brother. I love you. Yeah, man. Straight up. Thanks for joining Unscripted. Anything goes. Kirk Anderson. Yeah, man. Big up yourself. Tonight we're talking about the health benefit of oral sex. Yeah, man. The health benefit of it. And tomorrow we're going to talk about the risk that are associated with it if you actually do oral sex with somebody that is infected or has diseases. Those are the risks we're going to talk about tomorrow. Yeah, man. Can I just say that I'm a nurse? What does that mean? What does that mean now? Where you try to get that now? We don't know where you try to get that now. Yeah, you know everything. Yes, D-Mac, big up yourself. Yeah, man. No, it's a joke for you. Let me tell you, so come on camera then, no, man. We could have a little dialogue. You know what I'm saying? We could have a little dialogue. Nice to talk to somebody who knows more than me. You can educate me too, Mandy. You understand what I say? You can educate me. I never tell you that it is law, I just tell you what I read. Yeah. So you can go and read for yourself. So I debunked what I'm saying. You have that right. No, we're not afraid to talk to people. No, we're not afraid to talk to people. We welcome people to talk to. You understand? We welcome people to talk to. That's all you're going to learn. If somebody is saying something to you you're saying something that is wrong, what they need to do now is to say, yeah, this is actually against what you're saying. So you can actually have a dialogue. No, but it's more than one thing that I've read on Google. So we say everything on Google is wrong. Everything on there is wrong. Mandy. Everything on there. So yeah, there's a lot of fake news on there. But I tell you that I've been sitting down for 2 hours reading. I tell you that. Then that's why I'm trying to tell you. I'm telling you what I read. I never tell you it's law. I tell you what I read. You go out now and you read it. And if you know, this is how you dialogue. If you now say, right, that is wrong, then what you should do is say, Delvin, here is what is the correct thing. And I try to bring Mandy on. Maybe Debbie can come on too and debunk what I'm saying. I don't have a problem with that because dialogue is important. Because now you learn from me and I learn from you. So you said, Mandy, that you're a nurse. Nice. Right. So that means that what you're trying to say is that you know more than me on this. And I will give you credit that you do. So now, if I said something that you think is wrong or you know is wrong, then yeah, it's good to have the dialogue to say, I am going to correct you and here is why. Yeah, that's all me think you have a proper debate. You know what I mean? And you seem like a person that likes to debate. So if what I read is wrong, I want to be corrected on what is right. Yeah, I propose the people disagree with it. Do a 1-month trial and let us know. Yeah, man, they can actually try it. Especially if them have wrinkles. Try it, man. Try it. But that's what yeah, big up yourself, Omar. Big up yourself, yeah man. Yeah man. Nikeshi, big up yourself. Thanks for joining Unscripted, anything goes. Yeah, that's all we do it on this show, you know. It's not a bully pulpit. It's not a bully pulpit. And we have the right to actually come on and actually voice our opinion. I state out the rules earlier that, yeah, you have the right to come on. You have the right to talk. You have the right to debunk. You have the right to change the subject because it's unscripted and anything goes. I am no expert at this. That's why I read. Yeah, but I can be corrected with facts. So, Mandy, what's your name again? Debbie, my girl. Come up and correct Delvin. I want you to come up and correct Delvin. Can a woman take the cum out of her mouth and stick it in her vagina? Can she still get pregnant? Ask Mandy. I think she can. You can get pregnant. Yeah. Me not have wrinkles. Not a good person to experiment. But Mandy, remember we talk about the stress aspect. Yeah, you can reduce stress. Side, what you call it now. Whole heap of other things. Here's the proof. Everyone knows Hugh Hefner ate pum pum for years. He died a wrinkle pune. You say Debbie again. You say Debbie again. Debbie is watching the show, but she's not listening. Debbie, you're watching the show, but you are not listening. And that is a big problem I have with you. And I love you, girl, but you have to listen. You must listen, Debbie. I said swallow the sperm. What you're saying, he's swallowing his own sperm? What does that have to do with the vagina? So what does that have to, what does the sperm, what does that have to do with the vagina, Debbie? Put the camera on and come on and let's talk. Because clearly you can't understand what I'm saying. So let's have a dialogue then. Yeah, like, you know what I mean? You got, yeah. What lady sperm? We're talking the sperm from the man. I just said that earlier. Hello, Sterling, big up yourself, my brother. Thanks for watching. You gotta listen. You like when I'm talking, you have to listen. You can't just like make up things. Yeah, I told you. Go and Google what I said if you think it's not right. Because I'm just telling you what I've read, right? And then you're now, I talk about the sperm, now you're talking about him eat pum pum. How does that have to do with swallowing sperm? You know what I mean? And this is the disagreement that we have on the show. You know what I mean? You have to basically listen. You have to listen. Yeah. My your skin nice and smooth. Okay, Andrew, calm down. It's not. That's your. No. I'm gonna watch my show. Why you running to know? Why you running away now, Debbie? Yeah? Because I hold you accountable to listening. Yeah, I'm just trying to bring a point that you have to listen. You know what I mean? You have to listen. And if you're going to quote me the right way. Yeah, I never said anything about the man yet. But get to that. Yeah, but I'm talking about the woman swallowing the sperm. That's what it does. What does that have to do with you effing now and eating the vagina? And I hate when people quote me wrong. You have to quote the right things. Yeah. No, she's not joking. She's serious. I know when she joke for where she not joke. That's why she can run off of the thing now. Because she know I held her accountable. No, she wasn't being sarcastic, man. I tell you. Yeah. No, I know. Yeah, big up yourself, Kirk Anderson. How about swallowing? Yeah. So Kirk, you came in a little bit late. Yeah. Yeah. When the woman then blow the man, blow them away. They should swallow the sperm. Yeah, reduce the speck of wrinkles. Yeah, or diminish wrinkles. Yeah, and it tones, it makes the skin more radiant. Yeah. She'll start at 8, yeah. Yeah, man, so you miss a lot. Yeah. Karen, you almost smell like, no? No, man. Yeah, man. I'm serious. No, man. Come on, Delvin. I love you, man. I love you. You know, Delvin, love you. I love you. You and I were inextricably bound to this show, you know. Yeah, I'm tell you that already. We're inextricably bound to this show. You're good for ratings. I know that. Yeah, I know that. Yeah, you have a good heart. You know what I mean? You have a good heart, but open up the listening ears a little bit more, you know? Yeah, don't quote me on something that I didn't say. You know, don't do that. Yeah, don't quote me on something I didn't say. Quote me on the right things. Yeah, don't do that. I don't like that. Yeah, yeah. Last night you forgot what I said. You know what I say? Because you never listen, you just listen for what you want to hear. You can't listen that way. You have to listen to everything in its entirety. Yeah, but I love you still. Yeah, man. Too rough to me? No, man, I'm not rough to you. I love you, girl, man. Don't worry yourself. But sometimes you have to actually, you know what I mean, expound so that you understand. Yeah, you have to listen, open up the ears. There's nothing wrong with that. I love you. Yeah, man. Yeah, man, I love you. Yeah. No way, that's sick by stomach. You sick your stomach, Karen. Don't worry yourself, man. Yeah, I'm quoting you though. You just avoid my comment. Oh, okay. Sorry about that, Mandy. I didn't mean to avoid your comment. So let me go back and read what Mandy have to say. Let me read what Mandy have to say. Okay, Mandy there. I love you, girl. The skin nice and clean. Yeah, your skin nice and clean and smooth. Me see that. Yeah. Yeah. Yeah, you don't need no wrinkle cream yet. You don't need any wrinkle cream yet. But you see, if you start swallow from now, yeah, man. You see what y'all are 70, you look like all 40. Yeah, it's slow the appearance of aging. Yeah. Yeah, man. Big up yourself. Yeah, what you talking about? Eh? Yeah. Big up yourself, Stephen Brown. Yeah, man, my brother that. Yeah, man, straight up. Unscripted, anything goes. In that case, I have to agree with the host then. I got to run literally exercise time. I got to catch up the Kirk. Yeah, man, yeah. But big up yourself, Jeff. Thanks for stopping in, yeah? Yeah, man, but tell the ladies them to blow away. Tell them blow away. Blow away and swallow. There's only good effect to it. It's only good effect to it, man. And Mandy and Debbie Delvin love on us still. But you see me I said, if I was going to like disagree with something that you say, then I would tell you why I disagree with it. And then I will tell you the reason why I disagree with it. I tell you what I disagree with, and then I tell you the reason why I disagree with it. I would state facts. And then you can counter that. And then if I have a counter to that, then I counter it. But I'm not gonna just allow you to make blanket statement without holding you accountable to that. No. I spend time reading. I took 2 hours from my wife and sit down at the computer and read my ass off. Yeah. So if I'm presenting something to you that I read, then you have to tell me what is wrong with what I'm reading. You have to do that. Yeah. Yeah, man. Yeah. Yeah, you have to tell me. You have to tell me that I hold you accountable to what you're saying too. Because I spend time. Yeah, free time. Yeah, my wife said, come sit down with me. I said, I have to prepare for the show. And I came down and I sat down and she gave me the time and I read and I put the damn thing together. Then, yeah. So if I'm reading and quoting what I read, then tell me if it's wrong. And if you're a nurse or whatever you are, then you tell me what's wrong with it and what's correct. Yeah, straight up. This is a dialogue show here. Yeah, it's not about blanket statement. Yeah, straight up. Yeah, man, big up yourself, Jodian. Thanks for watching Unscripted Anything Goes. We're going to talk tonight about the health benefits of oral sex. And then tomorrow we're talking about the risk of doing oral sex with someone that is infected or has disease. Yeah. Yeah, man, we'll talk about that tomorrow. Yeah, man, so far we covered that it's good for the skin. Swallow the sperm. Don't just blow alone. Blow and swallow. Good. Nice chat. Now I have to run. Big up. Yeah, man. I love your persistent. Yeah, man. I love your man. Don't worry yourself, man. We love you, man. Don't worry, man. Nothing is personal here. Yeah, man. We love you. You know what I mean? This is not a bully pulpit. This is a shared pulpit. Yeah, man. It's a dialogue pulpit for everyone. Yeah, man. Melissa, thanks for joining. Unscripted Anything Goes. Tonight we're talking about the health benefit of oral sex. Yeah, man. So when you blow away and swallow the sperm. Yeah, that is what I read. You must swallow the sperm. Don't waste it. Because you're losing the healthy part of it that is good for you, the woman. Lots of health benefits in it. Lots of health benefits. But make sure the person that you're blowing is healthy. They go to the doctor and get a physical done to make sure that they're not exposed to any form of diseases, infections, yeah, STIs. Yeah, straight up. Yeah, man. So remember, like, you're depressed or you're stressed. Yeah, man, swallow the sperm. It has the chemical in there such as estrogen, cortisol, and oxytocin. And those are feel-good chemicals. So they will actually reduce the effect of depression and stress. So you don't have to take pill. You swallow sperm, semen. You swallow the semen. Yeah, that will actually change your mood and take you out of a depressive state. Good for you. Yeah, man, go ahead, ladies. Blow away and swallow the sperm. Yeah. Mm-hmm. Yeah, man, blow away and swallow the sperm. And actually, oral sex increases or improves your memory. It improves your memory. Yeah, man, the semen contains nutrients that is good for the improvement of memory. So you won't have so much memory loss. If you have memory problem, yeah, it improves your memory. So swallow away. Yeah, swallow the semen. Yeah, man, straight up. All right, this is where Debbie was talking about earlier about the teeth and the gums. Yeah, this actually nourish your hair. It's good for your hair on your head. Yeah, the semen is good for your hair, and it's good for your teeth, and it's good for your gums. Yeah, man, oral sex. Yeah, man. Yeah, man. It produce new blood. Yeah, yeah. It produce new blood. It's a blood thinner. Yeah, yeah. It produces new blood, so it's actually good for nourishing your gums and your teeth and your hair, and it tends to yeah it and it rejuvenates your facial muscles and the muscles in your body. That's what it does for you, ladies. So go ahead, blow away and swallow the sperm. Good for you. Yeah, man, Steve. Welcome to Unscripted Anything Goes. Yeah, man. So those are the health benefits. There's a lot more benefits on there that I didn't actually put down because some of them iffy, you know. Yeah, but as for the man them now, yeah, man, the man them, yeah. This when you actually perform oral sex on your wife or your girlfriend or whatever, it is very a good cardiovascular thing to do because it increase your breathing tendency, which cause proper blood circulation and cause you to be a lot more healthier. Because the fact that you will now have to put that mouth there and breathe to your nose, you have to have proper breathing to do that and do it effectively. So, yeah, for the men them, blow away. Yeah, man, for the men them, go ahead. Give your wife, girlfriend, oral sex. Yeah, it's good for her and good for you. Yeah, it actually increase your blood circulation and make you actually breathe better. Yeah, it's good for your health. Go away, man. Eat the vagina. It's good for you. It's good for you. Yeah, man. Yeah, man. It actually good. It helped to get good sleep. Yeah, it helped you to get good sleep. Yeah, if you take sleeping pills, if you take sleeping pills, yeah, throw them away. Throw them away. Yeah, man. Throw the sleeping pill away. The woman needs to swallow the sperm, the semen, like it's for the women then now. If they take sleeping pills, throw them away. Just swallow the semen as it has what is this now? It's called arginine. That is best known for that's the best known um sleeping pill substance that could put you to sleep. But if you actually swallow the semen, it has that ingredients in there that will put you to sleep. Yeah, a lot of women they might say, okay then, I do the oral sex, but they don't swallow it. So they didn't go to sleep. So if you actually have sleeping problem, insomnia and all of those things, yeah, you swallow the semen, it has those chemicals in there. Yeah. It's called melatonin. Melatonin, yeah. It has melatonin in it. Yeah, and that is good for sleeping. So that's naturally in the sperm. So if you swallow the semen, you'll get a good night rest from doing that. Yeah, man. It is a sure it's the best sleeping aid that you can actually do, ladies, to swallow the sperm. Yeah, man. Good for sleeping. Yeah, man. It also controls blood pressure, you know. Yeah, man. Controls blood pressure. Yeah, this is for the ladies again. When you swallow the sperm, it helps your blood pressure in the body. It regulates the blood. Yeah. So if you have high blood pressure, it actually help bring down when you swallow the sperm, it actually help brings down the blood pressure naturally in the ladies. Yeah. Mm-hmm. Men don't swallow sperm, so yeah. So the ladies, yeah, yeah, man. So you're suffering from high blood pressure, yeah, man. Swallow some sperm. Swallow some sperm. According to this thing here, you swallow some sperm. Yeah, man. Yeah, man. Don't take the pill. Yeah, man. Just go to your man, please your man sexually, and when you're done, swallow the sperm. Yeah. Oral sex for the woman actually reduces stress. Yeah, it reduces stress. Yeah, man. The same thing again. You swallow the sperm after you do the oral sex. Yeah, and it relieve you pain. Yeah, man. The semen contains something called um, endorphins and the oxytocin that works as a natural painkiller. Yeah, man. The oxytocin is like a painkiller. Yeah, yeah. It and the endorphins. Yeah, that naturally in the sperm. So when you swallow that, ladies, you got pain. Yeah, that take care of it. Yeah, man. According to this thing here, yeah, straight up. Yeah, man. Yeah, man. Yeah, man. It also helps you to know what you like. That's a positive thing. The oral sex. So the act itself, yeah, when both of you do it to each other, you get to know what works from what don't work. And that's positive communication from your spouse. Yeah, and positively doing it to please each other. So it create a positive atmosphere. Yeah, the emotions are actually positive instead of negative, feeling dissatisfied that you have not been pleased by the person you are with. So it won't lead to the depression, it won't lead to the anxiety, it won't lead to the fact that you feel disappointed. No, you're pleased by the person that you're with. So it actually lets you know what works for you and give you a positive effect. That's what it is. Yeah, man, straight up. Yeah, man. So, yeah, I'm not stay too long on that tonight. Yeah, so that's all I prepare for tonight. Anybody have any questions? Yeah, that's where I'm gonna keep it tonight. So tomorrow we're gonna come back and we talk about the risk that that associated with oral sex if you actually do oral sex with someone that is infected or has a disease. Yeah, we're gonna talk about those tomorrow. So make sure that your spouse get tested. Make sure you get tested. Yeah. And if you're gonna have sex with someone, make sure you know that they're clean. Or else don't do it. Don't do it if you feel that if you know that the person is risque. So ask some question. When last you've done your medical? Yeah. What have you been tested for? Have you been tested for everything? Yeah. Yeah, man, straight up. Because it's illegal for you to give false information when it comes to a sexual transmitted disease. You have to declare right away to your partner before you even have sex with them. Yeah. So make sure that you follow those protocols. Ask them. Yeah. Ask them if it's somebody new. And if not, no rush. Go and get tested. And you then go and get tested. Yeah. And if both of you are clean, then you go ahead. Enjoy the sex. Yeah, Delvin, one question. Go ahead, my sister. Go ahead, Michelle. Go ahead. You want to come on the camera or you just want to type it? You want to come on camera or you want to just type it? Let's see if you're gonna come on. Yeah, go ahead, my girl. Let's see if you're gonna come on. Big up yourself. I love you. If you don't want to come on, just cancel it and just type your question. Yeah. But mind you, remember I told you this. Yeah. Just go online and Google it. You know, education is good enough. Go ahead and you read, and you confirm what I'm telling you, or debunk what I'm telling you. But this is what I read. Yeah, and I spend time reading. So if I spend time reading, then you're interested in having oral sex with your spouse or to swallow sperm, you go ahead and read the effect of it. You know, yeah, this is not a bully pulpit. Everything you should confirm before you even do it. I'm not a medical doctor, and I'm not an expert in this field. All I do is just bring the topics and I do readings and I come and tell you what I've read. It's up to you now to go and actually read for yourself, confirm, and then decide what you want to do. Straight up, but I'm going to tell you what I read. love you so much. Yeah. What do you have to say now, Michelle? I'm waiting on you so we can actually wrap up the show. Yeah, man. My wife is calling me. She want me. Yeah, big up yourself, D Mac. I love you, girl. Yeah, man. Big up yourself. So the man, them don't get any benefits from the cum, from our cum. No, because remember, I say your cum is a internal thing, Unless you guys that what you call it now, that female ejaculation. And not many women have female ejaculation. Very few have that female ejaculation. Very few women. A very minimal amount of women can do that. Yeah. And most of the time, your cum is felt. It's not seen. Yeah. It's not seen unless you have that, what you call it, the squirting. And squirting is not coming. Squirting is not coming. For squirting is a high feeling for the woman, but it's the body um, pushing out water from the body. It just look good to the man them that, oh, they feel powerful, but it's not really coming. It's actually a high feeling, but you don't come. It's not an orgasm. Yeah, because you can squirt, but after, if you don't have an orgasm, you still feel incomplete. Yeah. Yeah, man. Yeah, man, big up yourself, Asheen. Tonight we're talking about the health benefit of oral sex. The health benefit. And then tomorrow we're going to talk about the risk of doing oral sex with somebody who is infected or has diseases. Yeah. So, yeah, for real. Yeah, man. So I'm waiting for Michelle to type her question. Oh, yeah. So when the man, yeah. So, yeah, so it's not even an issue there because you feel they come from internally. Yeah, it's not something that come out unless you have a female orgasm, which is that white liquid that runs out of the vagina. Yeah. If you want to talk about those white stuff, yeah, those discharge. Yeah, that's totally different. That's the body cleaning itself. Yeah. But sometimes the woman can have this discharge that comes out like a cum, like a white thing. Yeah. I don't think, I've never swallowed that, so I don't know, and I didn't read about that. So I don't know about those that swallow that. Yeah. But when the vagina is wet and it secrete that wetness, yeah, man, that tastes good. Yeah, that tastes good. Yeah, you can swallow that. I don't know what kind of vitamins you get from that, and I didn't read anything about that. So if anyone have anything to say about that, they can actually come up and voice your opinion about that. But I can't tell you when I didn't read it. I have to read it before I can tell you, and I didn't read that. There's a lot of information on the computer on this thing, tons of it. I can't get through all of it. Yeah, but I didn't read that part. But I tell you what I read. Yeah. Any more questions before we wrap up the show? Asheen, man, you're coming late, man. Watch over the show, though, and leave your opinion. Any more questions before I wrap up the show? So tomorrow, join for the risk, and that is more important. The risk side of it. Tomorrow, join, and I'll tell you what the risks are. Yeah, because risk is more, important. Yeah, so I'll tell you that tomorrow. Yeah, so, yep. So remember, embrace conservative values, and because we're law-abiding citizens and we are taxpayers, yep, and we do not break the law, we must always support the police. Yeah. So until tomorrow at 7, I love you. I love you. I love you. I love you. Mwah! Mwah! I love you.